everyone, and thank you for joining us today. My name is Kayla Rogers, and I am a health educator and outreach coordinator for the Women's Fund. I'm going to go ahead now and post the link to the survey just because I don't want to forget, and I always forget to copy and paste it until the very end. So I'm going to go ahead and paste that now into the chat so everyone will have access to that. And since it is 2 o'clock, I'm going to go ahead and get started. So today we're going to be talking about a very important topic, and that is diabetes. So before I get started with the presentation, I am going to turn off my camera just because it usually helps with any technical issues we have. I know last week we experienced some problems with Zoom, and I'm hoping that won't happen again. But I'm just going to go ahead and do everything that I can to prevent any technical issues. And usually if we turn off our video, that seems to help with limiting interruptions. So for those of you who may not be familiar with the Women's Fund, we are a nonprofit in the Houston area, and we provide women and girls with the tools they need to be advocates for their health. And we do this through focused seminars like today's class, curriculum-based classes for both women and girls, and our free publications. So if you're interested in downloading any of our free publications, we do have PDF versions on our website. There is a QR code there for you to use, and also the link. And we do also offer physical copies of our publications. So if you visit our webpage, you can put in a request for physical copies as well. But we have some really, really great publications. So definitely feel free to go and check those out. So today, this is our agenda. It's what we're going to be covering. We're going to talk about what diabetes is, diagnosing diabetes. So how is diabetes diagnosed? We're going to talk about risk factors for type 2 diabetes specifically, managing diabetes because that is very, very important. And then we'll have a small closing and review at the end. So as always, if you see this little green chat bubble pop up, that means that I am looking for your participation or feedback. I don't know if I put too many of these into the presentation, so I will just be asking questions as well, but feel free to answer or comment if you have any questions or any comments throughout the presentation. Feel free to put those into the chat. We are going to be starting off the presentation with a little myth or fact game, just to have you prepared. So by the end of this session, hopefully you will be able to state the different types of diabetes, identify at least 3 risk factors for developing diabetes, and then list 3 preventative measures for type 2 diabetes. So as I mentioned, we are going to start off with a fact or myth game. I'm going to go ahead and open up my chat. So for those of you who are feeling up to it, I would love for you to participate. So the first question, no one in my family has diabetes, so I won't get the disease. Is this a fact or a myth? Okay, we have a couple of answers so far, and they are all myth. Great. You guys are awesome. So this is definitely a myth. It's true that having a parent or a sibling with diabetes increases your risk for getting diabetes. However, many people with diabetes have no close family members with the disease. So just because no one in your family has diabetes or in your immediate family has diabetes does not mean that you have immunity to developing diabetes. Okay, next question. I have diabetes, so I can never eat sweets. Is this a fact or myth? Awesome. Yes, this is again a myth. So, sweets are full of simple sugars, which increase the amount of glucose in your blood more than other foods, but they are not off limits for people who have diabetes as long as you plan for them. It's best to save sweets for special occasions or as a treat, but to limit them. So, it's not that you can never have sweets, you just need to limit your sweet intake. Next question. My doctor put me on insulin. This means I'm not doing a good job managing my blood sugar. Fact or myth? All right, awesome. You're all again correct. So, people with type 1 diabetes must use insulin because their body is no longer producing the hormone. However, type 2 diabetes is progressive, which means that the body makes less insulin over time. So, your exercise, your diet changes, and your medications over time may not be enough to keep your blood sugar in control. So you may need to be put on insulin to keep your blood sugar in a healthy range. That does not mean that you're not doing a good job. It doesn't mean that you aren't doing what you're supposed to do on your end to manage your diabetes. It's just that with type 2 diabetes, it is progressive. So over time, your regimen may not be as effective as it was maybe towards the beginning. Next question. I'll know that I have diabetes by my symptoms. Is this a fact or a myth? Okay. I see a yes, I see a couple of myths. Okay, so this one is tricky, but we're saying it's a myth. So people with type 1 diabetes may have obvious symptoms, but those with type 2 diabetes may have few or no symptoms, depending on how far along their disease is. You may experience symptoms, you may not. More than likely, if once diabetes becomes more advanced, you'll start noticing those symptoms, but you can't just rely on symptoms to know that you'll have diabetes. And we're going to talk about testing and diagnosing diabetes a little bit later. My last question is, insulin is a cure for diabetes. Is this myth or fact? Right. Again, this is a myth. So at this point, there is no cure for diabetes. Insulin is a treatment option for some people, but it is definitely by no means a cure. Okay. So you all did fabulous during this little fact or myth. It seems that you know a lot more about diabetes than maybe you thought you did, but we are going to move on with the presentation and jump right in with what is diabetes. So diabetes is a serious chronic health condition, and it occurs when blood glucose or blood sugar is too high. So food is broken down into sugars to supply our body with energy. But when that sugar gets too high in the blood, it can become diabetes. So with diabetics, the body is either one, not making enough or any insulin, or two, not utilizing insulin well. Okay, so this causes the glucose to stay in the bloodstream and not reach the cells to be used for energy. And over time, too much glucose in the blood can lead to serious health problems like diabetes. Okay, so if you're wondering, well, what is insulin? We talked about it in the fact or myth game, and it's come up here. I forgot to put my little chart up. It's come up here as far as the body and how it utilizes insulin. Insulin is a hormone made by the pancreas that helps to get glucose from the food that we eat and into our cells to be used for energy. So if we are not making insulin or we're not utilizing it well, then that's going to cause that glucose to stay in our bloodstream and lead to serious health problems. Okay, so how common is diabetes? Diabetes is extremely common, and it's becoming more and more of a problem, especially here in the United States. So it is estimated that 34.2 million people have diabetes, making it the 7th leading cause of death. And approximately 16 million of these individuals are women, right, specifically. And 1 in 5 of these individuals do not know that they have diabetes. So again, maybe they don't know what the symptoms are, so they don't associate their symptoms with diabetes. Maybe they just aren't really experiencing any severe symptoms. But diabetes is definitely a problem. In fact, in the last 20 years, the numbers of adults diagnosed with diabetes has more than doubled. And when we talk about risk factors, this is definitely going to make sense as to how this problem has gotten to be so big over the years. So I included this chart, which I found from a report on the CDC website. And this is the estimated number of adults 18 and older who are diagnosed with diabetes, undiagnosed diabetes, and the total, when you add those two together, for the United States in 2018. So this chart I found pretty interesting, and it's super helpful. It breaks it down by age ranges, by sex, and then again by race and ethnicity. I'm not going to go over specific numbers here, but I did want to include this chart and a link to the report where I found it if you are interested in looking at some of these numbers or reading up a little bit more about this research. This is the QR code. If you don't have access to using this QR code now, I am going to be sending out a PDF version of the presentation later, and so you'll be able to scan this QR code then and kind of read up a little bit more about these numbers. So moving on to types of diabetes, we have polygenic and monogenic. Okay, so polygenic are probably the ones that you're more familiar with hearing, and they are type 1, type 2, and gestational diabetes fall into this category, but these are related to a change or defect in multiple genes. So environmental factors play a part in the development of polygenic forms of diabetes. Monogenic forms are mutations or changes in a single gene. So we're going to go over different types of diabetes that fall within these categories. So with type 1 diabetes, the body does not make insulin. So the immune system is actually attacking and destroying insulin-making cells in the pancreas, preventing it from making insulin. And so if you remember, insulin is what carries the sugar in our blood to our cells to be used for energy. So if your pancreas is not producing the insulin, then your blood sugar is going to go up. So type 1 diabetics are dependent on daily insulin injections for survival. And type 1 diabetes is typically diagnosed at a younger age. So children, teens are more likely to be diagnosed with type 1 diabetes. Type 1 diabetes, however, only accounts for about 5 to 10% of people with diabetes. Okay? A much larger percentage of people who have diabetes have type 2 diabetes. So with type 2 diabetes, the body is not using insulin well and cannot keep blood sugar at normal levels which leads to insulin resistance. So insulin resistance happens when cells are not responding normally to insulin. And so the pancreas is going to make more insulin in order to try and get your cells to respond, but eventually it's not going to be able to keep up and your blood sugar is going to rise, setting the stage for prediabetes and type 2 diabetes. So type 2 diabetes is the most common type of diabetes, accounting for 90 to 95% of diabetes cases, and can develop at any age, but it typically occurs in older individuals. So we're going to talk a little bit about that later on, but type 2 diabetes is definitely more common. Next, we have gestational diabetes. And gestational diabetes develops in some women while they are pregnant. Okay? So pregnancy hormones are going to interfere with insulin, leading to that insulin resistance, and the body is then not going to be able to make and use all of the insulin that it needs. So 2 to 10% of US pregnancies, women will develop gestational diabetes. And typically you find out in the middle of pregnancy because it's tested for between 24 and 28 weeks. Luckily, in most cases, gestational diabetes is going to go away after the baby is born. But unfortunately, it does increase the risk of developing type 2 diabetes later in life for both the woman and the child. Additionally, the baby is going to be more likely to suffer from obesity as a child or a teen. So now that we've talked about the polygenic forms, we're going to move on to the monogenic forms. So again, these are mutations or changes in a single gene. They are rare, accounting for 1 to 4% of US cases of diabetes. So it's definitely not as common. These forms are inherited from one or both parents or can develop spontaneously and are diagnosed with genetic testing. So as far as treatment goes here, some oral medications, some insulins, it really depends on the type and the individual. The two main forms are neonatal diabetes mellitus, which is abbreviated NDM, and maturity onset diabetes of the young, which is abbreviated MODY. So with the neonatal diabetes, this is going to occur in newborns and young infants. And typically, diabetes that occurs in the first 6 months of life is going to have a genetic cause. So the infant may experience delayed or slowed growth and development. Some signs and symptoms would be frequent urination, rapid breathing, and dehydration. However, these things can be kind of common with babies, especially frequent urination, which may make it a little difficult to detect. There are two types of neonatal diabetes. One is permanent or lifelong neonatal diabetes, and the other is transient or temporary and may disappear during infancy, but it could return later. The second type of monogenic form is maturity onset diabetes of the young. And this is much more common than the neonatal diabetes and usually occurs first in adolescence or early adulthood. So it does account for about 2% of all cases in people 20 and younger in the United States. But with the maturity onset, the pancreas has limited ability to produce insulin, and generally this individual is not going to have risk factors for type 2 diabetes, such as being overweight. So now that we know, what diabetes is, we've briefly discussed different types of diabetes. I now want to talk about signs and symptoms. So these signs and symptoms are associated with the polygenic forms of diabetes, type 1, type 2, and gestational. And yes, so let's just dive in. So urinary frequency. One sign is if you're having to go to the bathroom often. Another would be extreme thirst, feeling very hungry, extreme fatigue, blurred vision, or cuts or bruises that are slow to heal. And when I say slow to heal, I mean slow to heal. So, fun fact, I used to work as a scribe, and so I would see patients come in all the time because I worked for a PCP, and he would help them with managing diabetes. And we would see patients and then they would come back weeks later and they would still have open cuts or bruises because it just took so much longer for them to heal. Other signs that are common or some signs or symptoms with type 1 diabetes could be weight loss, even though you find that you're eating more. You're just not gaining weight and you're losing weight. And with type 2 diabetes, one of the distinguishing signs and symptoms is tingling, pain, or numbness in the feet and hands. So you may be wondering, okay, well, how will I know if I have diabetes? In the fact or myth game, we mentioned that you can't just rely on symptoms for knowing whether or not you'll have diabetes. And that's where testing and diagnosing is going to come in. So one of the most common tests used for diagnosing, but also managing diabetes is the hemoglobin A1C. So this test measures average blood sugar for the last 2 to 3 months. Okay, so hemoglobin is a protein found in red blood cells, and its job is to carry oxygen throughout your body. And the sugar in your blood, as you know, is called glucose. So when glucose builds up in your blood, it binds to hemoglobin in your red blood cells. And the A1C test is going to measure how much glucose is bound. So red blood cells live for about 3 months, and so that's why the test is going to show you the average for the last 2 to 3 months, the average level of glucose in your blood. So if your glucose levels have been high over recent weeks, you could expect that your hemoglobin A1C test would be higher. And this test is done regularly to manage diabetes, just to see where levels are and if any medications to adjustments need to be made. So a normal A1C would be less than 5.7. Pre-diabetes is 5.7 to 6.4, and then 6.5 or higher is considered diabetes. So this is a really well-known test that is used to diagnose diabetes. The next test is the fasting plasma glucose, and this actually measures blood sugar levels at a single point in time after fasting. So fasting is when you go for 8 hours or more without eating anything or having anything to drink except water. So this test is going to measure your blood sugar levels after fasting. For normal, you want it to be under 99. Pre-diabetes is going to be 100 to 125, and then diabetes is going to be 126 or higher. Next, we have the oral glucose tolerance test, and this checks blood glucose levels before and after drinking a special sweet drink. So this is a test that is used to diagnose diabetes in general, but gestational diabetes. So first, a healthcare provider is going to draw your blood to measure your baseline fasting glucose level, and then you'll drink a liquid containing glucose, and you'll have your blood tested again after an hour, 2 hours, and then possibly even 3 hours. So with these readings, normal is going to be less than 140. Pre-diabetes range is 140 to 199, and diabetes is going to be 200 or higher. So again, this test is usually done at somewhere between 24 and 28 weeks of pregnancy. And then the last test that we're going to talk about is the random plasma glucose test. This test checks blood at any time of day when you have severe diabetes symptoms, and you could be diagnosed if it's greater than or equal to 200. So with this, you don't have to be fasting overnight. You can have this test kind of done at any time. So I mentioned pre-diabetes quite a bit so far in this presentation, and we saw kind of what the ranges were for pre-diabetes, but just like diabetes itself, pre-diabetes is a huge problem. And there are an estimated 88 million US adults 18 and older with pre-diabetes in 2018. So with pre-diabetes, you have impaired glucose tolerance. So your blood sugar is high, but it's not quite high enough to be considered diabetic. Prediabetes is going to increase your risk for developing type 2 diabetes, as well as developing cardiovascular disease. So as far as signs and symptoms, some people may experience diabetes symptoms, some people may not. And as far as ranges go, we talked about these with each of the tests that we discussed previously, but for your A1C test, you would be pre-diabetic if you fell between 5.7 and 6.4. For the fasting blood sugar, 100 to 125. And for the oral glucose tolerance, it would be a 2-hour blood sugar of 140 to 199. So I actually found this really cool chart that I want to show you on the CDC website, and it's just the road to type 2 diabetes. So it shows you each of these tests, and then it's going to tell you what's normal, what can be considered pre-diabetes, and then what would be diabetes. So I just wanted to include something that was quick and easy for you to look at. Again, I am going to send a PDF version of this presentation, and so this would be something that would be nice to have for yourself, or to pass this information along to other people as well. So now we're going to talk about risk factors for type 2 diabetes. And the reason why we're focusing on risk factors for type 2 diabetes is because, one, type 2 diabetes is very, very prevalent. Again, accounting for 90 to 95% of diabetes cases. And two, because you can have some kind of control and you can work towards preventing type 2 diabetes. So I wanted to focus on type 2 diabetes specifically because there are some things that you can do to lower your risk. The first 3 risk factors on this list are age, family history, and race or ethnicity. These are non-modifiable risk factors, but they are risk factors. So these are things that you cannot change, you do not have any control over, but they are risk factors. So I did want to include them. So age would be 45 and older. You're at a higher risk for developing type 2 diabetes. Again, family history. So if you have a parent or a sibling with diabetes, and then your race. So Blacks, Alaska Native, American Indian, Asian American, Hispanic or Latino, Native Hawaiian, or Pacific Islander are all at increased risk for developing type 2 diabetes. The rest of the things on the list are things that we can have some control over. So pre-diabetes puts you at a higher risk. Being overweight, physical inactivity, so if you're not active at least 3 days out of the week, and then a history of gestational diabetes. You might be asking, well, I can't control if I develop gestational diabetes, but some of the risk factors for gestational diabetes include being overweight, and that's something that you can control. Um, so things that you could do would be lose weight, eat healthy, be physically active, and you have control over each of those things. So what can you do to lower your risk for type 2 diabetes? One thing is losing weight if you're overweight. So there is a research shows that you can lower your risk for type 2 diabetes by losing 7% of your body weight. So it would be around 14 pounds if you were 200 pounds. So if you are overweight, losing even a little bit of weight can help to lower your risk. You can also move your body more. So getting at least 30 minutes of physical activity 5 days a week. If you haven't been active, but you want to start being active, you can speak with your provider about the best way to go about that. You can also just start slow. So maybe going out for walks more, and then building from there. If you are interested in learning more about physical activity, we do have a physical activity presentation that you can watch as well to get a little bit more information on that. You can also eat healthy foods and smaller portions to reduce the amount of calories that you eat each day and help with weight management. We also have a presentation on nutrition that talks about the benefits of eating healthy food for your body, which do include helping to prevent chronic diseases such as diabetes. And then being smart about your beverage choices. We talk a lot about eating healthy, but the things that we drink can have just as much of an impact. And so it's important that you're making smart choices with your food, but also with your beverages. Try to include more water and stay away from sweetened beverages like juices and sodas. Treatment options for diabetes. Again, we discussed in the factor myth game that there is no cure for diabetes. So some people will require insulin, some people will require oral medications, sometimes it's a combination of both. There are many different options and combinations for managing diabetes. And just know that it doesn't always have to be medication. Sometimes you can incorporate lifestyle changes, and that will work to bring your blood sugar down. So, lifestyle changes would include better diet, physical activity, and also managing stress, because stress can make managing your diabetes harder. So, considering ways to reduce your stress and keep your stress levels down can be helpful as well. It is important that you speak with your primary care provider and other specialists who are helping you to manage your diabetes, such as podiatrist, dentist, ophthalmologist, dietitians. Speaking with them to find a treatment option that works best for you. Whenever I would work with physicians, we would see a lot of patients who were not compliant with their medication regimen because they didn't want to be on medication. And I can't speak for every physician, but the ones that I worked with, they wanted to make the patients happy, but they also wanted to keep them healthy. And so they would say, I know you don't want to be on this medication forever. Maybe we could try you doing the medication for a little bit and also working on lifestyle changes to bring your numbers down. And then maybe eventually it could get to the point where you're only doing those lifestyle changes. They want to work with you. So if you're afraid to speak to a provider about your diabetes, or you're afraid to get tested because you feel like you may have it and you don't want to be on medication, just know that there are so many treatment options. And at the end of the day, your provider just wants you to be the healthiest version of yourself. And so they're going to try to work to find a treatment option that's going to be best for you. So with um, managing diabetes comes along with treatment. Treatment is not just a one and done thing. Um, Diabetes is a chronic condition, so it's something that you're going to be dealing with um, for the long haul. And so it's important that you know how to manage your diabetes. So your blood sugar is going to vary throughout the day. This is normal. And the number of times that you check it is going to depend on the type of diabetes you have, what your treatment regimen looks like, and also how well controlled your diabetes is. So, for some people, you may not be checking it that often. For others, it may be multiple times a day. That's something that your provider would be able to help you with, giving you a number of times and when you should be checking. But when we think about target blood sugar levels before a meal, the target is 80 to 130. And then 2 hours after the start of a meal is less than 180. Again, if you have diabetes, you want to talk to your provider about your specific target levels. This is just kind of um, general recommendations, but if you do have diabetes, you may have a different target. That's something that you would discuss with your physician. So we talked about hyperglycemia and having high blood sugar and some of those symptoms, such as the urinary frequency and the fatigue, the blurred vision. But hypoglycemia is a concern when it comes to managing diabetes as well. So hypoglycemia is when your blood sugar is too low or drops below 70. Although it's more common in type 1 diabetics, it can happen with type 2 diabetics, especially when you're taking your medicine, you're getting more active, and you're eating less than usual. So the combination of taking the medicines and making the lifestyle changes sometimes may bring the blood sugar down too low. And so signs of hypoglycemia would be feeling very shaky, sweating, or feeling chills or clamminess, having some confusion or a fast heartbeat, feeling lightheaded or dizzy, nauseous, having pale skin, feeling weak, or experiencing impaired vision. So if this is to happen to a diabetic, they would want to have glucose tablets or a few ounces of a fruit juice or maybe a few pieces of hard candy just to help bring their blood sugar back up. After 15 minutes or so, you want to check the blood sugar again and assess where you are. Maybe you need another piece of hard candy or a little bit more juice. But if you do experience low blood sugar regularly, you want to speak with your provider so that adjustments can be made to your regimen. So going off of that, other things that we need to think about when we think about managing diabetes are healthy diet and maintaining a healthy weight. And I know that you're probably thinking, well, we already talked about this with preventing diabetes, but we're going to talk about it again because just as it helps with preventing diabetes, it helps with management of diabetes as well. So nutrition and physical activity are important parts of a healthy lifestyle, especially when you have diabetes. Along with other benefits, following a healthy meal plan and being active can help to keep your blood sugar within that target range. So in order to manage your blood sugar, you'll have to balance what you're putting into your body. So what you're eating and what you're drinking, balancing that with physical activity and any medications for diabetes if you take them. What you choose to eat, how much you eat, and when you eat are all important things to keep in mind when you're trying to keep your blood sugar in that range that you and your physician have discussed. Okay. So one of the things that I just mentioned, you probably don't really think about or hadn't really thought about. When we talk about diabetes, what we eat and how much we eat, those are probably things that come up or that we think about. But when we eat may not be something that we think about. So depending on your medication regimen, you may need to be eating at the same time each day, or your schedule may be a little bit more flexible. But no matter what your regimen is, you should not skip or like long delay your meal. So when you do this, your blood sugar can drop too low. So if you're having any questions about, well, when should I eat throughout the day? That's something you want to discuss with your provider, but you don't want to skip meals. One of the most common meals that we skip is breakfast, and that's not something that we want to do. So when you skip the day's first meal, your blood sugar is more likely to be high after lunch and after dinner. So skipping that first meal in the morning can have repercussions for the rest of the day. Additionally, skipping meals can create blood sugar fluctuations and extreme hunger cravings, which can then lead to overeating at your other meals and high blood sugars. So if you're wondering, well, I'm not a breakfast person, but what is something that I could eat for breakfast as a diabetic? You want to consider a breakfast that has a good amount of protein, because protein is going to help slow your digestion and make your blood sugar rise more slowly after your meals, and also lower on the carbohydrates, because this will help your body make less blood sugar. Okay. As far as planning when to eat your other meals, because again, you don't want to skip meals, you want to make sure that you're not having your meals or your snacks too close together, because you want to give your body time to naturally drop your blood sugar after you eat. So your meals should be spaced 4 to 5 hours apart. But if you need a snack between then, do it 2 to 3 hours after your last meal. So making sure that you're spacing out those meals, but that you're definitely not skipping them. We do have a presentation on nutrition if you're interested in that, but you can also speak to your provider, who may recommend a dietitian or a nutritionist to help you as far as planning out meals, or talking about foods that would be helpful or foods that are hurtful. In general, foods and drinks that you want to limit include those that are high in saturated fat and trans fat, high in salt, sweets, beverages with added sugars, and also alcohol. So if you use insulin or diabetes medications that increase the amount of insulin in your body, alcohol can make your blood sugar level drop too low, especially if you haven't eaten in a while. So if you are going to consume alcohol, definitely make sure that you eat food, but also do so in moderation. Okay, as far as physical activity goes, or maintaining a healthy weight, I mean, physical activity is very important to doing that, along with the healthy diet. So healthy diet and regular physical activity can also help with blood pressure and cholesterol. And these are two factors that can contribute to cardiovascular disease. So middle-aged adults with diabetes are usually considered at moderate to high risk for cardiovascular disease. So managing your diabetes is going to help to reduce that risk for cardiovascular disease. And through managing your diabetes, if you're eating a healthy diet and maintaining your weight, being physically active, you can also reduce your risk for high blood pressure and cholesterol, which are, again, contributors to cardiovascular disease. So if you remember our presentation from last week over heart health, you'll remember that a lot of these things are linked together. The last little box on the slide is keeping a log of your blood sugar readings. This is so important because your physician is going to want to know how your readings are at home based on your lab results and the readings that you get at home, your medication regimen, or whatever your treatment is, can be adjusted. So if your numbers are a little low, they may cut back on your medication. If they're high, they may add something. And so it's important that you're keeping track of your blood sugar readings. So I am almost out of time, so I'm going to try to go through these last couple of slides quickly. I apologize for running over. Diabetes is just such an important topic, but One of the reasons that diabetes is so important for us to talk about and it's so important for us to manage if we do have is because it can lead to other serious chronic illnesses and other serious diseases. And one is diabetic ketoacidosis. So this is a very serious condition that can actually lead to coma or even death. It develops slowly and is more common in type 1 diabetics, but can happen in those with type 2 diabetes. Diabetic ketoacidosis is when the body does not have enough insulin to use glucose for energy. It begins to burn fat for energy, and this produces ketones. Ketones are acids, and so the buildup of ketones in the blood makes it more acidic and can make you very ill. So there are a lot of symptoms there that, for time's sake, I'm not going to read, but diabetic ketoacidosis is a serious condition, again, that can lead to coma or even death. So making sure that you're managing your diabetes and you're going in for checkups as you need to is extremely important. Other reasons that it's important to manage diabetes, over time, those high blood sugar levels can lead to other problems, including heart disease and stroke. So diabetes can damage blood vessels and lead to heart disease and stroke. Kidney disease, also called diabetic neuropathy or nephropathy, I cannot say this word, I apologize, is kidney disease caused by diabetes. Eye problems, when we talked about symptoms, we talked about blurred vision or impaired vision. So diabetes can damage your eyes and can actually lead to low vision or even blindness. Dental disease, diabetes can lead to things like infections, gum disease, or dry mouth. Nerve damage, also referred to as diabetic neuropathy, can cause nerve damage that affect different parts of your body. And this would be, especially your hands and your feet. So when I talked about earlier a symptom for type 2 diabetes being numbness or tingling or pain in your hands or feet, that is caused by nerve damage from the diabetes. So when you go into your physician's office during your exam, they may do a monofilament exam where they kind of put a little wire, a single wire, like on your foot or your hands to kind of test your nerves. Foot problems as well. Diabetes can cause nerve damage and poor blood flow, which can lead to serious foot problems, pain, and infection. And so they'll also examine your feet during the exam. Sexual and bladder problems, including erectile dysfunction, loss of interest in sex, bladder leaks, and retained urine. And then also hypoglycemia, which we talked about, is that low blood glucose or low blood sugar. Other conditions with diabetes or diabetes and other conditions, one is depression. So depression is common among people who have chronic illnesses such as diabetes, but it can be treated. So if you are feeling sad, hopeless, or anxious, make sure that you relay these feelings to your physician. Cancer and diabetes. Diabetes is linked to some types of cancer, including liver, pancreas, colon, breast, and bladder. Research is still being done to learn more about the link between type 2 diabetes and these cancers, but it's important to note that many of the risk factors for cancer and diabetes are going to be the same. So being overweight, physical inactivity, poor diet, smoking, age, race, and ethnicity. Dementia and diabetes, so high blood glucose increases your chance of developing dementia. And so you want to tell your doctor if you're forgetful, because dementia can make it difficult to manage your diabetes if you're not able to remember to take your medications. And then finally, sleep apnea. So people who have sleep apnea, which is when you stop breathing for short periods of time during sleep, are more likely to develop type 2 diabetes. and sleep apnea can make diabetes worse. So there is treatment for sleep apnea if that's something that you suffer from, and you can learn more about sleep apnea in our sleep hygiene presentation. Okay. So just a quick review in closing. Again, diabetes is a serious chronic condition, and it can greatly impact multiple areas of your life, and can even lead to other conditions. Living a healthy lifestyle can help with prevention and management. So eating a healthy diet and getting plenty of physical activity are things that you can do to help prevent diabetes, as well as prevent other conditions. And speak with your healthcare provider about the things that you can do to prevent or better manage your diabetes. There are many, many different treatment options out there and things that you can do to live your healthiest life. So I thank you so much for staying over with me. I know that this presentation was a lot and it wasn't as interactive as I would have liked it to be. Just as with heart health, this topic we could deep dive into and we could spend multiple sessions talking about diabetes, but I just wanted to give you an overview of diabetes and talk to you about things that you could do to manage and prevent diabetes if you don't already have diabetes. If you do have any questions or concerns, you can put them in the comment or the chat box, or you can email us at healtheducator@thewomensfund.org. I know that sometimes we think of questions later in the day, and so if that happens to you, you can feel free to email us there and we will be able to get back to you. The survey link as well as the QR code is here. I did post the survey link into the chat box. So if you want to scroll up through the chat box and find that link, we would greatly appreciate if you would fill out the survey and provide us with some feedback